everyone, and welcome to another episode. I wouldn't call it an episode, it's just another discussion, free-form conversation on global health talks. Today, we have a very, very interesting conversation with Dr. Jan Jones-Schenk. Dr. Schenk currently is Senior VP and Executive Dean of the College of Health Professionals at Western Governors University. And that's no small undertaking. This is a school with over 30,000 competency-based students. It is, in fact, the largest in the United States. And we'd like to first learn some things about this school and this offering, get to meet and know Dr. Jones-Schenk. I'm going to call you Jan because that's just too much for me to pronounce.
Too much for me too.
yeah, and please call me Michael.
Great.
And we're going to kind of tee this up. And then hopefully, by the time we reach toward the end of the conversation, we're going to find out exactly from Jan what her puzzle piece is relative to building out a global conversation with regard to nursing. And before I begin with Jan, let me just share a story with you. I have a very, very good friend. He and his wife run an IVIG company. And so they have a cachet of RNs who direct the business, who travel about. It's very, very high-end IVIG. And I passed him, and in conversation, he said, "This has been the craziest month I've ever had with my nurses." And I said, "How so?" He goes, "Well, one nurse called me from a hospital we will not mention and said the paint crew had gone out into the parking lot and painted out the doctors' names in the parking lot and had repainted the nurses' names on their same spaces." I thought, that was kind of interesting. And then he said, "My negotiations with nurses now are like Major League Baseball teams negotiating contracts." And he said, everybody wants to take advanced nursing degrees. They realize that being a nurse right now in COVID times is a very big blessing and in many ways a huge curse. So with that tee up to the diving board, tell me a little bit, Jan, about the history of Western Governors University. Many people perhaps don't exactly know what it is.
Well, thanks, Michael. It is actually, many people have said to me, such a well-kept secret. How can you be such a large national university and have so few people know about you? The university is young in university terms, 25 years old this coming January, when 19 governors got together after many months of talking about their challenges with higher education and signed an agreement to establish a university that would be nonprofit, that would be competency-based, and that would use technology to expand access, primarily in rural regions. But really, the access issue is beyond geography. It is also access in relation to equitable access. Open enrollment is what I mean by that. So making access to higher ed more available to more people. So 25 years ago, this was a very innovative and bold experiment. It still is, and we still are challenged often about what we do and what is competency-based education. But with a university now that's about 130,000 students nationwide, and as you said, my college, 30,000 health professions students, we've been able to really serve a great need in advancing education for working adults, for rural communities, for underserved groups, in a very affordable, cost-effective way, and very high-quality way too.
Thank you, Jan. That's very, very helpful. And aside from stating the obvious, because we have many people who are not as familiar with nursing as they may be about other things in their life, can you define for us competency-based as it relates to what it is you do and why it's so important?
Yeah, so I'm going to talk about it a couple of different ways. So first of all, competencies, we talk about our curriculum as being primarily competencies and assessments of those competencies. So traditional curricula really focus a lot on the content and learning objectives, and we certainly have those elements in our curricula. But what we're most concerned about is what a graduate knows and can do and can demonstrate competence in when they graduate. So if you get a letter grade, you might get an A, you might get a C. Does that mean you knew 70% of the material? Does that mean you knew 100% of the material? When you graduate from a competency-based organization, you have to have demonstrated 100% of the competencies defined in the program of study.
Jan, thank you. You know, it's so funny. I've interviewed over 7,000 doctors for PBS, and there's an old adage, and I've interviewed for the most part the best doctors, but the reality is there's that old adage: what do you call the person who graduated last in their medical school class?
Doctor.
It's very true.
It is very true. It is very true. And but I also think it's important because students, and we're all students, deserve to have something meaningful when they graduate.
Sure.
And so, you know, the measurement of competencies, the attestation of achievement of competencies is an important move. Now, I've been doing this for almost 15 years. And when I first started doing this work in a competency-based model and talking about this with other national leaders in education, I was really perceived as a radical. I'll tell you now that the American Association of Colleges of Nursing recently came out and recommended that all nursing programs move to competency-based education. So that was a validating moment.
Well, thank you for that. That's no small accomplishment, and you are to be commended for playing an important role in that. But you know, these are the kind of people that we get on Global Health Talks, so we're not overly surprised. Let me ask you about what the reason is for looking at palliative care nursing. Could you comment on that?
Yeah. So one of the great things about our model is that we use a master curriculum. So that means you can curate the best content and the most late-breaking competencies and skills into a curriculum to make it the most relevant for people who are working in the field. And palliative care is a great example of that. So we all know, I'll say this, another adage you may have heard, you know, only 1% of people in the US, well, in the world, have babies, but everybody has to take maternity care in their nursing education. But all of us are going to die. And we don't include palliative care in our basic nursing education. So sure. What is that about? Palliative care is largely misunderstood. People do not understand the value of its impact. And so a few years ago, we, working with a large national organization, the End of Life Care Consortium, Nursing Consortium, we found these modules that they were developing around basic knowledge around palliative care for nurses. And this includes how to have those difficult conversations, how to guide patients and families to set their own goals and to think about what their end of life needs to look like. And for us, we took that away and said, what can we do? Well, what we can do is we can deliver that basic education at scale. So we implemented that content into our master curriculum. And now, roughly about 5 years later, over 40,000 practicing nurses in the US have those basic competencies in palliative care.
Wonderful, wonderful, wonderful. Thank you. In remote and rural settings, since we encounter that quite a bit in the global conversation for everything we do, can you comment a little bit about how you support learning in those areas?
Mm-hmm. Yeah, so that's really such a primary, I guess I'd call it a prime directive, really, for our mission. We were formed really to provide education regardless of time or place. And a big part of that focus was rural communities. We knew that access to higher ed was spotty at best. Mm-hmm. But we also, and I feel really strongly about this from the health professions perspective, you know, for many years, we've tried to solve the health professions shortage problem in rural areas by taking people who live in another community, educating them and paying for their education and saying, we will pay back your loan if you go live in this health shortage community for 3 years. And they go do that, and then they leave. So why not educate the people who already live in those communities to serve those communities as health professionals? Because they are vested and they're probably not going to leave.
Yeah.
So this is really fundamental, I think, for rural healthcare globally, is being able to get the access to the community and then build that capacity within the community. It's not without its challenges, and digital access, the digital divide is real.
Yeah. And we will come back to that because I have some more questions about that. But nursing is considered comparatively as a softer skill. Okay. And by that, I don't mean to demean nursing at all. It's hugely important. But because many people equate it with a softer skill, what role does it really place? What role is placed on it in the current theater of value-based healthcare and that model?
Yeah, it's so interesting. And your opening comments really made me think about this too, because I think in my whole career, and my primary education was as a nurse, nurses have been considered a cost, and nursing is a cost center. And I think that's one of the big issues in our health system that's been laid bare by COVID. Because you can have, in fact, this was even said in my own community, sadly, by a legislator. I know there are beds. I've seen the beds. Well, the beds without a nurse really doesn't get you where you need to be. So you've got to have that care provision. I know some of you probably have seen the videos on television where if you've got, for example, a COVID person, a person who's suffering from COVID, having to physically move them and reposition them multiple times. It's a careful, thoughtful management of what you see, what you hear, what's going on, and then being able to intervene in that moment. It is art and science combined.
Well, as I may or may not have mentioned, I see what you're doing is a huge component, and I will tell you that on Global Health Talks, we've recently, very recently, it's been our pleasure to interview Howard Catton in Geneva, Switzerland, who runs an organization 28 million nurses strong, and will be speaking in November at that Congress for the ICN. And in addition to that, we have a mutual colleague and friend, Dr. Terry Knapp. And Dr. Knapp is the founder and CMO of something called Carespan. And Carespan has many orbits, many things it's doing, but one of them is called Clinic in the Cloud. And it's going to be an access point for rural populations. And it was Terry who first mentioned you to me and Global Health Talks. And I'm interested in knowing if you had, for example, starting with you three as a triad, what is the relationship potentially, for example, between you and the access ways that Carespan might provide?
That's a great question, Michael. I think what I think we have been able to prove our greatest competency in is our ability to deliver high quality education at scale. And the technology that Terry has pioneered with Clinic in the Cloud, I think is really enhancing the clinical care technology. So being able to really develop providers' ability to have the right kind of data resources and the right kind of documentation resources and access to labs and all the clinical elements that you need to deliver care is really a great facilitative tool. And what we know how to do is to do these things at scale. And we know how to expand access. And so I think there's a real intersection in our work. It's interesting. I happened to meet last week, I was at a national meeting and I met an individual that Howard has just hired as the, I think her position is the CNO for ICN. It's a new position there. Oh. And she was formerly the chief nursing officer for Ontario. And we were talking about the challenges that we're having in the US, and we were in these meetings and we were talking about public health challenges and, all the things that COVID has surfaced for us. And she said, one of the things that she thinks is a challenge across all global nursing practice is nurse safety. So that's an interesting point that I don't think we've really considered, is when you've got dispersed learners or providers, how do you ensure safety for all of those? And I don't just mean technological safety, I mean actual physical safety, as we've seen that become an increased issue for providers. So that is one area where I think there's a global intersection and a conversation that needs to happen.
Jan, I would be remiss in not having you comment on some very special skills. They used to be referred to as softer skills, but now they're actually power skills that come into play for nurses in their specialized training. Obviously, there are going to be some emotional moments, true of all nursing, but particularly during this COVID period. Mm-hmm. Can you comment for us on what you do as a group and in terms of your training to mitigate or soften the impact of what for some, frankly, may seem like a terrifying moment in time in their profession?
Yeah, absolutely. So Michael, a few years ago, we implemented a very untraditional course for all of our undergraduate nursing students. And the course is about social and emotional learning. And it's unique in that it's a facilitated small group, face-to-face in the sense that it's on Zoom. And the goal of the course is really to help our students develop, as you say, these power skills to enable them to handle and and really engage in high stakes conversations, which has always been a part of nursing practice, but is even more a big impact on nurses today. And it is through these communication strategies, understanding one's own bioreactions, knowing when one is having a reaction, knowing how to mitigate that, being able to de-escalate high stakes conversations that are escalating out of control, being able to understand other workers, how others of us approach situations differently, and really being able to deeply listen both to our coworkers and to patients and to other stakeholders that we may be engaging in. And we've been doing this for, as I said, about 5 years, and we've had remarkable results in the sense that nurses tell us, hey, I've been in practice for 15 years. I didn't think I needed this. This was really going to be a waste of my time. And now I've come away with skills that not only are helping me professionally, but in my personal life with my family. I now have a new set of skills that are helping me to enrich those relationships. So at a time, at a point, an inflection point in our history where the pandemic is putting so much pressure on nurses in practice, both from a clinical perspective, but also these really sort of high stakes kinds of situations that nurses are handling day after day after day. These skills are the things that really help them with resilience, self-care, and being able to do it. And honestly, what our nursing professionals have been called to do is remarkable. They continue to go in day after day, do above what any kind of normal nursing practice that we've known in the past requires of them. And it's a remarkable time, and they just keep doing it.
You have articulated that just beautifully. Put in simpler terms, I don't believe there is a nurse on this planet who is the same nurse that they were 2 years ago.
Couldn't agree more. Well, I'm very passionate about the work that we're doing, about the students that we're serving, about the opportunities that we have to solve really big problems in this country. Yes. So I think we've really we've teed it up, is what I would say, and now I think we all have to figure out how we're going to come together and bring, as you say, our diverse talents to the solutions.
Well, we are connected across many forms of media, and it is important that this story gets out because so many people don't know about it. Even as a simple situation as the university not really having that much of an open media profile about what it does. That's something we'll have a conversation about very soon. Okay. So
great. Sounds great.
Thank you so much. The dog did not bother us in the background one bit. And we really look forward to watching the odyssey of what it is you're doing and seeing where it goes and what happens. And we wish the school and you and the nurses and all of their families a healthy pursuit of what it is they want to do for us.
Thank you very much.
I can't even begin to tell you. Thank you.